If this kind of stuff doesn't make you mad, I don't know what does. So this article is titled Musculoskeletal Adverse Events in Dogs Receiving Bedenvetmab, or Librela. And remember, this is the drug that is also called Silencia in cats. It's a monoclonal antibody injection that works against nerve growth factor, NGF. So the objectives of this study were to conduct a specialist lid disproportionality, this is a lot of big words in here, but we'll explain it as we go, disproportionality analysis of musculoskeletal adverse event reports in dogs treated with Librela compared to 6 comparative drugs with the same indication, so for arthritis pain. Furthermore, to report the findings from a subset of dogs whose adverse event data underwent independent adjudication by an expert panel. These experts are like big-time veterinarians and radiologists. So it was a case-controlled study and case series analysis. The sample population was 19 client-owned dogs, and then for the comparison to drug reactions, they used the European Medicine Agency's vigilance database over a 20-year period from 2004 to 2024. They had veterinary specialists in surgery individually review all adverse event reports during that time period to Librela, which is fairly new, Rimadyl, Medicam, Previcox, Onsior, Galliprant, and Daxocox, which I believe is Daramax here in the States. And the primary null hypothesis was that Librela's adverse event rate would not exceed that of the comparative drugs, the NSAIDs, by more than 50%. And the second hypothesis was that adverse event reports would surge and then taper following the launch of new drugs. So usually something comes out, we get a bunch of reports, like when Rimadyl first came out, all of a sudden we started seeing gastrointestinal ulcers, vomiting, diarrhea, kidney failure, liver failure. And so there was a huge spike in that at the beginning, and then we figured out, ooh, dogs with high liver enzymes shouldn't be given this drug, certain dogs with other issues shouldn't be given this drug. And so you see this big surge, and then we kind of narrow the population that is given the drug. We're choosing more wisely. So then the adverse event reports tend to die down. Plus people just, kind of forget about reporting after a drug's been out for a long time. But the results, the disproportionality analysis, did not support the hypothesis. So their hypothesis was wrong. They thought that there would be no more adverse reactions with Librela than there were with the non-steroidals. Wrong. So we'll go through what some of these are. The disproportionality analysis did not support the hypotheses. Ligament tendon injury, polyarthritis, fractures, musculoskeletal neoplasia, which is cancer, and septic arthritis were reported 9 times more frequently in Librela-treated dogs than the combined total of dogs treated with the comparative non-steroidal anti-inflammatory drugs. A review of 19 suspected musculoskeletal adverse events by an 18-member expert panel unanimously concluded a strong suspicion of a causal association between Librela and accelerated joint destruction. The study supports recent FDA analyses by demonstrating an increased reporting rate of musculoskeletal adverse events in dogs treated with Librela. Further investigation and close clinical monitoring of treated dogs are warranted. Let's look at the study a little more closely. So first of all, what is osteoarthritis? It is the most prevalent chronic pain condition in companion animals and is a significant contributor to reduced quality of life and premature death. Although a diverse array of therapeutic approaches are currently available, all possess limitations, including suboptimal efficacy and the potential for severe adverse reactions. Chronic pain management is challenged by the trade-off between safety and efficacy. Pain-killing drugs that provide significant pain relief can carry a higher risk of adverse reactions than safer but maybe less effective options like glucosamine chondroitin joint supplements. The therapeutic dilemma is complicated by differing risk perceptions between veterinarians and caregivers. Veterinarians, due to their medical training, may be more comfortable with the risks associated with prescription pain medications, whereas caregivers may be more hesitant, sometimes declining or limiting their use even even when deemed necessary by the veterinarian. This disconnect is underscored by a 2018 study revealing that 22% of dogs for whom pain meds were recommended by their veterinarians did not receive them. And this is that old dilemma where you feel bullied into taking the medication, you buy it, you take it home, and you throw it away. Post-marketing pharmacovigilance is crucial for continuously monitoring a drug's safety and efficacy after it enters the market, as clinical trials cannot capture the full spectrum of potential adverse reactions. Who is the clinical trial being done on? It's being done on the millions of animals that the drugs are used on after they get passed by the FDA or the European Medical Association. It involves a combination of voluntary reporting of adverse drug reactions by healthcare professionals and the public, and proactive surveillance programs, including government-funded, industry-sponsored, there's the problem, and independent research. That's a good one. This is an independent study. Their findings inform regulatory decisions, which can range from label updates and limited use restrictions to, in rare cases, and this is the problem, rare, market withdrawal if the risks outweigh the benefits. When an animal exhibits unexpected clinical signs following drug administration, differentiating these effects from the underlying disease or a new related condition can be complex. True. Nevertheless, prompt identification of potential causal relationships is paramount for ensuring patient safety. Here's an example. The thalidomide tragedy. Now, if you're not in my age group, you may not know what the thalidomide tragedy is, but it exemplifies the critical importance of rigorous preclinical and post-marketing drug safety surveillance. Insufficient testing and a lack of robust post-marketing surveillance systems failed to identify the teratogenic potential of thalidomide. That means birth defects. This resulted in widespread use of the drug, leading to severe birth defects in thousands of children, highlighting the potentially devastating consequences of delayed recognition of drug-related adverse events. In December 2024, the FDA issued an open letter to veterinarians, alerting them to neurological and musculoskeletal safety signals identified during their post-marketing surveillance of Librela. Now, for the FDA to send that letter, that means they got a lot of complaints, because they don't do that lightly. It's hard to get them to do that. We tried with the isoxazolines. We finally got the, maybe these shouldn't be used on animals who have seizures. They didn't give the, by the way, this is going to cause seizures. Whatever. The FDA's analysis of Librela identified 18 distinct safety signals in dogs administered Librela, encompassing neurological events, urinary problems, and musculoskeletal disorders. Notably, the FDA observed a disproportionately elevated reporting of lameness in dogs receiving Librela. Gee, it was supposed to treat that. In response, the Center for Veterinary Medicine advised veterinarians to proactively inform pet owners about these potential adverse reactions. Now, I would like to know, if your dog has been given Librela, did your veterinarian stand there before giving the injection when they recommended it? Did they give you all 18 possible distinct safety problems that could be associated with this drug? Or did they say, this is the miracle drug, it's going to solve your dog's problems, he's not going to limp because he's not going to have osteoarthritis pain? If you weren't told the 18 distinct problems that could be associated with the drug, then you didn't get the full story. So this study utilized a retrospective case series design. Case recruitment was initiated by author 1 following the observation of a suspected case of rapidly progressing osteoarthritis in a dog receiving Librela. This case was shared on a specialist veterinary forum. Subsequently, over an 11-month period, multiple clinicians who subscribed to the forum contacted the author to share concerns regarding serious adverse events in dogs treated with Librela. Based on these communications, an independent working group was formed comprising clinicians with first-hand experience with these adverse events. The primary objective was to investigate a potential association between Librela administration and the observed pathology. Important note, these people are not employed by a drug company. These are independent veterinary specialists who specialize in pain and arthritis and imaging. So these are people who are not getting paid to give us the results that we want. Things that we're seeing: ligament tendon injury, polyarthritis, fractures, musculoskeletal cancer, and septic arthritis were reported 9 times more frequently in Librela-treated dogs than the combined total of dogs treated with the other 6 NSAIDs. Furthermore, accumulated adverse event reports for Librela over 45 months exceeded those of the highest ranking NSAID, Rimadyl, by 24 20-fold, and surpassed the combined accumulated adverse event reports of all comparator drugs over 240 months by 3-fold. So we've got 6 drugs, 240 months versus Librela for 45 months, and Librela has 3 times as many reports. That's a lot. That is really high. So the study reveals a striking disparity in musculoskeletal adverse event reports to Librela compared to the 6 drugs. Ligament tendon injuries, polyarthritis, fractures, musculoskeletal cancers, and septic arthritis were reported 9 times more frequently in Librela-treated dogs. Worryingly, since its European release, Librela has accumulated 20 times more reports than the highest ranking comparing drug, Rimadyl, and 3 times more than all of those 6 drugs combined over a 20-year period. Furthermore, independent expert review of a subset of cases strongly supported a causal association between Librela and accelerated joint destruction. Librela experienced rapid market penetration following its 2021 European release. Zoetis recently reported global distribution exceeding 21 million doses, translating to an estimated average daily distribution of over 15,000 doses. Scary. This initial market success has been tempered by emerging concerns regarding Librela's safety. These concerns have been amplified by various factors, including the FDA's safety update. Yay, FDA, you just didn't go quite far enough. Negative press coverage, the European Commission's investigation into potential anti-competitive conduct by Zoetis, and the emergence of online communities, yay us, disseminating safety concerns. This confluence of events has fostered a climate of apprehension and confusion. Addressing these concerns requires unbiased and rigorous post-marketing pharmacovigilance to evaluate the drug's true risk-benefit profile. Nerve growth factor plays a pivotal role in bone and cartilage repair. Serious subclinical cartilage and bone degeneration often precedes clinical signs. So we already have cartilage degeneration, and then we add on something that doesn't allow it to repair. Recent claims of Librela's rare or very rare adverse events are based on methodology where they basically say we've sold this many doses, so they take the market share, how many doses have been sold, how many reactions were reported, and they get to say that, oh, it's a very rare occurrence. Remember that adverse event reactions are reported between 1 to 10% of how many there actually are, because most of them don't get reported. They get to say very rare, when in reality, that's a really bad way to do it. Given nerve growth factor's diverse roles and prior evidence of rapidly progressing osteoarthritis, subchondral bone fractures, and atraumatic joint luxations in humans and animals, Librela-associated adverse events are an expected consequence of nerve growth factor inhibition. The hypothesis that rapidly progressive osteoarthritis is a uniquely human problem has faced significant criticism. That is because anti-nerve growth factor monoclonal antibody developed for the treatment of osteoarthritis in humans, tanezumab, which in 2021 failed to achieve marketing approval due to an unfavorable benefit-risk profile, primarily due to a syndrome called rapidly progressive osteoarthritis, which occurred more commonly in treatment groups when compared to controls. So we know that the same drug causes this in humans, and so therefore did not get approval, but I guess our dogs and cats, maybe, are not as important. And so it's fine to kill them. I don't know. The joint safety claims outlined in Librela's datasheet are based on radiographic assessment, I love this, of 5 healthy beagles who received the recommended dose. 5. We x-rayed 5. The study reported mild cartilage erosion in 2 dogs, despite erosion being, by definition, a severe form of cartilage pathology. 2 out of 5, that's 40%. What if 40% of dogs are going to develop this rapidly progressive osteoarthritis? What if? That's a lot. Furthermore, despite being invited to provide annotated images to clarify the discrepancy, Zoetis declined to do so. When viewed in context, Librela's limited pre-marketing clinical trials raised serious concerns. Only 89 dogs received more than 3 doses. And crucially, no radiographic screening for accelerated joint degeneration was conducted. Zoetis was unable to self-report accelerated joint destruction due to the absence of radiographic investigations. If you don't look for it, you're not going to find it. Consequently, we must must rely on post-marketing surveillance to determine whether companion animals experience the adverse joint pathology observed in humans and laboratory animals treated with anti-nerve growth factor monoclonal antibodies. So here's their nice little pictures, before and after. Yeah, all this bumpy stuff, that's severe, serious arthritis. That is painful. Given Librella's popularity, this perspective would be understandable. However, this response would be analogous to assessing the risk of NSAID-induced gastrointestinal harm by comparing the incidence of perforating gastric ulcers with NSAID sales figures. It should be obvious that such an approach neglects the critical fact that NSAIDs can induce subclinical harm, which is undetectable without inconvenient tests such as endoscopy. I forget what the percentage is, but if we were to scope every animal that is on NSAIDs, we would find microhemorrhage, microbleeds in a very, very large percentage of them. Crucially, unlike the gastrointestinal mucosa, which possesses significant regenerative capacity, cartilage damage, once incurred, is largely irreversible. This fundamental difference underscores the gravity of adverse events associated with these drugs. Most reactions in the FDA's analysis occurred within the first week post-injection, whereas most human rapidly progressing osteoarthritis and 13 of 19 cases in our study manifested at least 6 months after treatment initiation. So if you're only looking at this drug for 3 injections, that's 3 months in healthy beagles, that's really different from giving this injection month after month after month after month in older animals who already have some joint erosion, already have comorbidities, and then we get this huge influx of adverse events. An FDA panelist involved in the adjudication of humanized monoclonal antibodies for NGF eloquently summarized our current belief. Quote, all parties agree that the use of anti-NGF monoclonal antibodies is effective, but they are associated with a unique, rapidly progressing form of osteoarthritis, and we can only speculate as to its causes, end quote. In animals just as in humans, the goal of effective pain management is paramount. However, we must also ensure that our therapeutic interventions do not inadvertently exacerbate the underlying condition. To uphold the highest standard of care for companion animals, we hope to apply the same rigorous scrutiny to veterinary monoclonal antibodies as are employed in human health care. This started out as me reading a letter from Zoetis in response to the FDA's warning and to this article, but hey, we had to start with the article. So, dear valued customer, this is sent out to all the veterinarians. In 2 recent letters to the editor and 1 study, this one, a group of authors, independent authors, specialists, in this field, whatever, have raised concerns regarding the safety of Librela and a potential association with accelerated joint destruction in treated dogs. Zoetis does not exclude the possibility of any adverse event and welcomes researchers' interest in the safety of Librela. Well, that's good. That's really good. We take the adverse events reported in the study seriously and have reached out to the authors to ensure we have as much information as possible to support our ongoing safety monitoring. Well, so far they sound yay, but they want to share their perspective on the potential limitations of the publications and the actions Zoetis is taking. Clinical decision-making should be guided by high-level scientific evidence. A solid body of evidence supports the safety and efficacy of Librela, including target animal safety study. Okay, they studied dogs, they studied cats. 3 randomized clinical trials. Not sure what they are because it doesn't go into that. Studies on quality of life in dogs after Librela and veterinarian satisfaction with Librela. You know, if 9 out of 10 of your patients get better and seem happier and more comfortable, you're going to have a good opinion of it. And that other one, sorry about that. Study reporting over 3 years of global pharmacovigilance data for Librela. Yeah, and that data isn't looking so good, folks. We got some really high reaction rates. So I don't know if I would say that that's a plus. They say overall adverse event rates remain stable, and that's one of the things they're talking about. Like, we're still getting the same number of reports. It's not dropping off. It's still high. And they've sold nearly 28 million doses. Well, good for you. You're making a lot of money while the dogs are dying, but it's a trade-off. No single type of adverse event has been reported at a rate of more than 1 in 1,000 doses distributed. That's what they were talking about. We've sold 28 million doses. 1 in 1,000. Somebody do that math. That's a lot. That's higher math for me right now. But but there's a lot of zeros involved there. So if 1 in 1,000 and 28 million doses sold, that's a lot of dogs with problems. And by the way, for use in dogs only, women who are pregnant, trying to conceive, or breastfeeding should take extreme care to avoid self-injection. That rules out some veterinarians. Hypersensitivity reactions, including anaphylaxis. Anaphylaxis could potentially occur with self-injection. Librela should not be used in pregnant, breeding, or lactating dogs. And by the way, that self-injection, maybe you'll develop rapidly progressive osteoarthritis if you inject yourself. I don't really want to do that. And should not be administered to dogs with a known hypersensitivity. Well, you don't know they have a hypersensitivity until you give it and they react, and then you have a problem. And they say the most common adverse events reported in a clinical study were urinary tract infections, bacterial skin infections, and dermatitis. Nothing about the neuromuscular arthritis, etc. Anyway, buyer beware. Do your homework, do your research before you consent to these drugs being used for your dogs or cats. Find as many alternative ways as you can. Layer things on, layer things on, layer things on. Physical therapy, energy, massage, supplements, whatever. I wouldn't get near any of my patients with a 100-foot pole with this thing. That's just my professional opinion, but who am I? Anyway, have a great day, everybody.